Hello everyone, welcome back. In today's video, we are going to discuss the surgical options that patients have in cosmetic gynecology. Now I'll just again enumerate the reasons or the patients who can benefit from these surgeries. Now what are the basic surgeries that we do in this? Number one, we are doing labioplasty. Number two, you can avail for hymenoplasty. And number three, we have vaginoplasty. Now labioplasty is correction or alteration of the appearance of the lips of the vagina. As previously discussed, the vagina is surrounded by tissues on both sides which we call as the labial lips. Now when can you do surgeries to correct them? As we said, the appearance, sometimes the labial lips may be a little large and they do not appeal to the patient. Number two, there are certain types of clothes which the patients feel uncomfortable in or they have inhibitions about wearing because of the appearance of that area. So these are the patients which undergo labioplasty. Labioplasty is a very not a minor procedure, but yes, it takes hardly around 30 to 40 minutes. There is minimal care that the patient needs to take. When you talk about the rest, the patient can recover or rejoin their or resume their duties and work lifestyle within a week to 10 days. Certain precautions have to be maintained which are usually easily manageable. The second type of surgery that you can avail is hymenoplasty. Hymen is a very thin covering of the vagina. There are many reasons why a hymen can break. It is a thin curtain, you can say. Number one, physical activity in the form of horse riding. Number two, when you are swimming. Number three, if a girl experiences heavy bleeding with passage of large clots, even that can be a reason when the hymen can break. And again, when you're having your first intercourse. Hymen is usually considered culturally important because in many cultures it indicates or represents the virginity of a female. So this can be corrected by a very minor surgery which does not need more than a day's admission. The third type of surgery that a female can avail is vaginoplasty. Vagina is a tissue which has immense stretching power as we experience or see during a normal delivery. Due to the stretch of the normal delivery or when the baby pushes down, the vaginal wall becomes lax, and as the number of deliveries increase, it is further aggravated. So basically, we are just correcting that defect by supporting the walls of the vagina. There is nothing that is removed or added. So what we basically do is we support the vaginal walls by giving certain stitches, approximating or bringing them near. It does not need a lot of care because like we doing an episiotomy during normal delivery, this can be easily taken care of. Again, this is not a major procedure that is involving a lot of rest, and it will give immediate relief or correction of the problem. These are very minor procedures which a female can undergo. Again, I want to stress that these are the problems which are usually encountered by females, but due to inhibitions or due to lack of awareness or due to unavailability of the options, many of the patients are not availing of them. As gynecologists, it's our duty to address these rather than brushing them aside, that these are problems which might not need correction. When we talk about hymenoplasty, it is usually bringing the margins of the flaps of the hymen or taking fresh mucosal flaps from the vagina and joining them. The tissue heals beautifully because there is a lot of blood supply or vascularity to the vaginal walls. Normally, it will take some time for the tissue to be absolutely perfect. So whenever we are doing any of the plasties, it is advised to refrain from sexual activity for at least 3 months so that they heal well. Majority of these surgeries can be done as daycare procedures, with the extent of if somebody feels they need additional care, they can be in the hospital for a day or two, but it is usually possible to go back on the same day. When we talk about hymenoplasty, it is usually advised to get the procedure done at least 3 months before there is a particular time limit, because there will be a little restriction in activity and there should be refrained sexual activity for at least a month to 3 months time. Thank you.